feel?
Good.
Good? Just good?
Great.
How would you describe it though? Does it hurt at all?
No, no.
Okay.
All right, a little smaller cup now. What did you do to your lower back? There's something going on there.
I don't know. Years of sports.
Ah, what were you playing?
Football and track.
I think we're here. What position were you? Football?
Wide receiver.
I don't know, you might have been tackled once or twice.
I was gonna say, I think you got sacked a few times here. Plus, it's the weight of the equipment, the heat that's worked up during that, and the dehydration. This may have been the beginning of a lot of this becoming. Now, we did try and implement something called Adopt a Cop. We were not able to push through with that just because of some of the ethical issues on the part of the police officers. But we are going to go ahead with our Foster a Firefighter and start with the New York firefighters. Clear the smoke out of their lungs. We can actually pull smoke where the equipment, I think, got him. This is right at the pivotal point with the scoliosis.
So the discolorations are not bad technique. It's actual proof or some type of
evidence
that you are actually affecting some change metabolically.
Yes. Basically, if the color comes up, it's old blood that was in the tissue. We aren't creating it. This is old blood.
That suction's not that hard.
No.
Like do a hickey or something.
No. So with him, this is turning a brown color, so this is from football times also, and there is some dark purple in there, so this is childhood. Something did happen to him at one point. So the colors will tell you different things. We've even gotten yellow out of people who were jaundiced as babies. All of it is still in there. We get coal dust out of it, and all of a sudden, their arm. It's really upsetting for them though, because they walked around for 20-some years, and it was just that simple. So we've had some amazing things. We were never able to pop those pockets with just manual work. It took a vacuum. So as you learn to work with this, it'll teach you a lot too. And I don't know if you notice as I move the cup, it flashes white every once in a while on him. Like right there. So those are also like scarred. Plantar fasciitis is itis, inflammation. So we're also going to just pull that out. Doing some rolling rotations here. This feels amazing. And if any of you do reflexology, this does reflect up to the rest of the body. This work is amazing for diabetics. The neuropathic issues they deal with and the fear of not being able to feel their feet. So please work on people with diabetes. If we can drain the feet, very often they can get some sensation back and start walking again. So neuropathies from MS, all kinds of things. You can do a lot of help for people. So right now what I'm doing is flexing the foot and just working up and down, all through the fascial sheath, all through the attachments. And you see the difference in color, how she got nice and red through here, and then this is staying very white. So we know there is an issue with blood flow in here, which means restriction. And again, any contraindications that are contraindicated for massage are also contraindicated for massage cupping and metacupping. So it is contraindicated to work in this zone on someone who is pregnant, and I've already cleared that this is not the case here. So I will come up and drain right around the medial malleolus, bring that right up. Now this is the same leg on our model that had the scar in the gastroc that was impeding some lymph flow. So we're gonna make sure her lymph is flowing and that her ankle does not swell up on her again. So you can feel the restriction in the cup. This actually feels yummy, especially if you've had a lot of debris sitting in here for quite some time. Nice. We had a fellow at a show whose foot had broken so badly it was turned backwards. So that happened in 1984, and I got him on the table about 3-4 weeks ago. We improved his gait in such a way, it was amazing. Just opening the scar tissue up, loosening the fascia, and getting his lymph flowing again. He now has, you know, an increase in movement of almost 60%. So he's a very happy man. there was no flexion or extension of that foot before we were able to help him soften it up. So it's just a great technique. You know, the vacuum is just a wonderful addition. And the biggest thing with this is everything else you know, all the other techniques, you can translate with the cup. The psoas work is really impressive. You will find that you're going to be changing a lot of your ways of working. And it makes it a lot more comfortable for the person on the table. Now for fun, this really cute little cup. So now I can get in and really, would you feel that? You feel like a sandy, kind of sugary crystal formation in here, all the old debris from when she had this accident. Just drain all of that up. Our goal here is not only to drain her tissue, but get her lymph system going again.